Hello, my friends. I'm Dr. Jocelyn, a urologist and specialist in men's health with 5 years of hands-on clinical experience. Today, I'm going to share advice that most men never hear. Advice that might make you blush for a moment, yet has the power to transform the way you think about intimacy, confidence, and your health as a man. Before we get started, do me a quick favor. Tap that like button, subscribe to the channel, and tell me in the comments where you're watching from. I love seeing how far this community stretches, whether it's a bustling city apartment, a quiet retirement town, or somewhere in between. Now, let's get into the heart of the matter. Here's something older men rarely hear. Intimacy does not retire, and passion never carries an expiration date. Yet, far too many men give up, thinking they're too old for a deeper connection, or worse, feeling betrayed by their own bodies. But here's the truth we need to clear up today. Problems in the bedroom are not always about age. Often, they stem from small, manageable habits, things you can begin to adjust immediately. Today, we're going to focus on one of those very topics, a subject that men frequently ask me about, a topic that might feel taboo to discuss, yet has the potential to open the door to more trust, deeper pleasure, and better performance. Over the past 5 years as a urologist, I've helped men like you, men in their 50s, 60s, 70s, and beyond, reclaim confidence in their health and in their intimate lives. And I can tell you this with certainty. The science is clear. When men truly understand how their bodies function, the biology, the emotions, and the daily realities, they make better choices, reconnect with their partners, and rediscover a sense of freedom many assumed they had lost forever. So today, I want to break this down into practical, actionable advice you can use. We'll explore 5 key truths and common mistakes men make about intimacy, bodily fluids, and connection. Each one builds on the last, so stay with me. Number 1 will likely surprise you the most. Let's begin with habit mistake number 5. Thinking vaginal fluids are dirty. We'll start here because this is where so much embarrassment originates. Vaginal fluids are not random moisture. They are a biological masterpiece. They are produced by 3 primary sources: the Bartholin's glands, which secrete silky fluid to reduce friction; the Skens glands, sometimes referred to as the female prostate, which add lubrication during arousal; and the cervix, which produces mucus that protects and balances the vaginal environment. These fluids are composed mainly of water, amino acids, enzymes, minerals, and lactic acid, all designed to protect delicate tissue, reduce infection risk, and make intimacy safe and pleasurable. On an emotional level, when a man rejects or judges these fluids, it can create shame in a woman. Practically speaking, it damages trust and makes intimacy feel unsafe. The shift is simple. Do not view these fluids as gross. Recognize them as the body's natural signal that connection is possible, safe, and welcomed. Habit mistake number 4 is ignoring taste and smell. This is the question I hear most privately from men. What about the taste or the smell? Here's the biological truth. Fluids naturally vary, and multiple factors influence this variation: diet, hydration, hormones, stress, and even medications. For example, pineapple, citrus, and proper hydration often result in a fresher, lighter taste. Conversely, garlic, onions, alcohol, or coffee can give fluids a stronger edge. Hormonal changes also play a role. Around ovulation, fluids are generally neutral. During menstruation, there may be a faint metallic note. After menopause, fluids may become less abundant or slightly more acidic. Emotionally, it's important to understand that variation is completely normal. No 2 men smell the same after a workout, and no 2 women taste the same either. Practically, if you notice a sudden unpleasant change accompanied by discomfort, it is usually a common, treatable imbalance, such as bacterial vaginosis or a yeast infection. That is a situation for a doctor's visit, not a reason to break trust or intimacy. The key mistake men make here is turning a natural variation into criticism. Gentlemen, acceptance is far more arousing than judgment. Moving on to habit mistake number 3, overlooking safety. Many men wonder, is it safe to swallow fluids? For healthy couples, the short answer is yes. Fluids are primarily water, enzymes, and protective compounds. Biologically, they are actually less risky than everyday activities we rarely think about, like kissing or sharing drinks. However, caution is necessary. Fluids, like semen or blood, can carry sexually transmitted infections, chlamydia, gonorrhea, herpes, syphilis, trichomoniasis, or HIV. The risk increases if one partner has an active infection, and even more so if the receiving partner has mouth sores, bleeding gums, or ulcers. Biologically, risk exists. Emotionally, the safeguard is honesty. Practically, the fix is straightforward. Know your status, get tested together, and use barriers when starting new relationships. The mistake is assuming no visible symptoms means no risk. True intimacy, gentlemen, comes with trust and transparency. Awareness, communication, and care protect both your health and your connection. Habit mistake number 2 is staying silent out of embarrassment. I see many couples lose connection not because of illness, but because of silence. A small change in smell, a question about safety, or curiosity about trying oral intimacy, when left unspoken, grows into shame. Biologically, the body is always changing. After menopause, after illness, or even after a change in diet, fluids naturally change as well. Emotionally, when couples hide their concerns, the other partner can feel rejection without any explanation. Practically, small issues go untreated, intimacy becomes awkward, and partners gradually pull away. The mistake is silence. The solution is simple. Communicate with kindness, curiosity, and respect. Speak openly about changes, ask questions gently, and reassure your partner. This builds trust, strengthens connection, and keeps intimacy safe and enjoyable. Habit mistake number 1 is forgetting the emotional power of acceptance. This is, without question, the most powerful lesson I can share. When a man embraces his partner fully, including her fluids, he communicates, "I accept you completely. I trust you. I love every part of you." Biologically, that acceptance helps a woman relax, which deepens arousal and increases natural lubrication. Emotionally, it heals years of quiet shame women have carried about their bodies. Practically, it makes intimacy joyful, playful, and fear-free. The biggest mistake men make is thinking intimacy is just mechanics. In reality, the strongest performance enhancer you will ever experience is your partner feeling fully accepted. Acceptance is not just a feeling, it's a form of connection that amplifies pleasure, fosters trust, and makes passion last for years. When both partners feel seen, heard, and respected, the entire dynamic of intimacy changes. So, what do you do with all this information? Here's a simple, practical 3-step action plan that can make a real difference. Step 1. Have the health conversation. Gently suggest testing together. This is not a matter of mistrust. It is a partnership. Twice a year is a healthy standard, giving both of you reassurance and confidence. Step 2. Pay attention, but don't judge. If something smells different or seems unusual, approach it with curiosity and care. A refreshing shower together, encouraging hydration, or supporting her to consult her doctor if needed are all simple ways to maintain intimacy without shame. Approach these moments as a team. Step 3. Practice acceptance. Remind yourself that your partner's individuality is not a flaw. Her fluids are not dirty. They are a sign of health, readiness, and trust. Embracing them communicates care, understanding, and love. When you internalize this, intimacy becomes joyful, relaxed, and deeply connected. It is no longer mechanical. It is relational, emotional, and fulfilling. I know some of you may still feel shy or uncomfortable about this topic. That is completely normal, but let me reassure you, you are not alone. Every man I see in my clinic has these same questions. Every couple experiences these concerns at some point. And the difference comes when conversations are approached with honesty and care. When couples talk openly about their bodies, their preferences, and their needs, intimacy does not just survive, it thrives. Safety does not kill romance. Safety builds trust. And trust, my friends, is the foundation that allows passion to last for decades. Understanding these principles, practicing them consistently, and embracing them with respect creates a cycle of connection that strengthens both physical and emotional bonds. The healthiest, happiest relationships are built on communication, acceptance, and shared understanding. So, gentlemen, here's the final takeaway. Passion does not retire. Your 60s, 70s, even 80s can be your most connected, most confident years if you let go of shame, embrace acceptance, and care for your health together. Do not waste money on gimmicks, supplements, or unsafe pills promising quick fixes. True confidence comes from understanding your body, communicating openly with your partner, and practicing acceptance consistently. Care for your body, maintain honest conversations, and approach intimacy as a shared, joyful experience. When you do, every touch, every connection, and every moment of closeness becomes meaningful, safe, and deeply satisfying. If this video resonated with you, take a moment to hit that like button, subscribe to the channel, and share it with another man who could benefit from this reminder. Tell me in the comments where you're watching from and what topics you would like me to cover next. Remember, small, thoughtful changes can bring freedom, comfort, and confidence back into your life. Intimacy is not just about mechanics, it is about trust, respect, and love. Your partner feeling fully accepted is the ultimate performance enhancer, far beyond anything a pill or supplement can offer. I'm Dr. Jocelyn, and remember this: passion does not expire, and neither should you. Embrace knowledge, communication, and acceptance. Let your health and your intimate life flourish, no matter your age. By making informed choices and fostering connection, you can enjoy your most confident, passionate, and fulfilling years yet. The journey to better intimacy begins today, and it starts with understanding, care, and trust.